So this is not the most flattering angle and it's not the greatest lighting in the world, but I did my best. So there's a lot of background stuff, just ignore it. That's the kitchen. It's dirty. Okay. I am all over the place. Thank you, ADD. So today I want to talk about the physical therapy that I've been doing. It's called pelvic physical therapy, pelvic floor physical therapy, pelvic pain physical therapy, women's health physical therapy, any of those terms. So it actually tends to be covered by insurance, which is great news. It can be super, super helpful for a lot of different things. So just as a disclaimer, this video may have a lot of information that people are sensitive about or they don't want to hear about it. So if you're squeamish, if you think this is TMI, just click out of this video. No harm, no foul. But if you are interested in what it is, who it can help, why I'm doing it, then please keep on watching. So like I mentioned, this type of physical therapy or PT has many different names. And I think the place that I go just calls it pelvic physical therapy and women's health physical therapy. So it's pelvic physical therapy under the umbrella of women's health, basically. So like I said, it is covered by a lot of insurances, which is amazing. You have to get a referral from your primary care physician or another physician like an OB or a gynecologist to be able to get your insurance to cover it. Now, my insurance is actually even covering it. Sorry, I had to back up a little bit because of the sun. My insurance is actually even covering it. So I have Medicaid. I have Apple Health through Washington State. And as long as I receive the treatment from an in-network provider in the state of Washington, then it will be covered for a certain number of visits per year. So for me, that's not really a big deal because I leave to go back to Buffalo in about a week. And then I'm only back for a week in March, and then I'm back for 3 months from May to August, and then I'm gone again until the middle of December of 2018. So I'm only going to be able to go and actually have hands-on physical therapy for the next week, for a week in March, and then a couple of, probably 4 times a month when I'm back in the summer. So I don't think I'm going to reach the threshold that they set, which in my understanding, it's basically an arbitrary number. They picked it out of a hat and they were like, I don't want to pay any more than this, and they're not going to. So that's just the nature of the beast. Again, you can pay out of pocket, just depending on what you want. So why am I doing it? I am doing this because I have Crohn's disease and I have endometriosis. The primary concern is pelvic pain. Now, here's where we get into a lot of personal details, TMI, and I am comfortable sharing this because I've put everything else out there. So here we go. Why stop now, you know? So I have endometriosis, or I have suspected endometriosis. The reason it's suspected is because I've never had a laparoscopic surgery to go and look for adhesions. So with the suspected endometriosis, you would expect some level of pelvic pain. Now, my level of pelvic pain is a little bit off the charts. It's pelvic pain involving ovulation, it's pelvic pain involving bowel movements, urinary, function, urination, anything like that. Like, there's pain associated with it. It wakes me up sometimes. It's more than just cramping. Now, you may think, oh, endometriosis, period related, it's period cramping, it's menstrual cramps. That's not this type of pain. This type of pain is an actual pelvic floor pain. Most people have heard of Kegels. So one of the assessments they do in this type of physical therapy is have you do a Kegel. They'll do biofeedback to see how your muscles are contracting, how your muscles are relaxing. So part of what my issue is my muscles just don't relax. They're in a constant state of constriction. So even when I cough, my Kegels are not engaged. Like, there's no Kegel happening in the way that you and I would think about it. Because my muscles are already so tight, there's always tension there. So that can cause a dull aching pain in and of itself. But whenever you're trying to pass anything through that muscle, whether it be fecally, urination, menstruation, insertion, penetration, anything like that. If that muscle is constricted, nothing is going to pass. So for me, the goal is to get those muscles to relax. But other people do this physical therapy for other reasons. They can do it for bowel incontinence. They can do it for urinary incontinence. They can do it for dyspareunia, painful sex. They can do it for a myriad of other things. And it's not just women. Men can do it too. So the first appointment is basically a physical exam. My dog is being weird. It's basically a physical exam. So they'll touch the muscles around the outside of the area, like the pelvis, the area between the anus and the vagina, or the perianal region, that's what it's called, perianal region. They'll touch all around, make sure that they're just like you would at any other pelvic exam, like make sure there's no lumps, bumps, weird things. And then they'll touch the muscles and make sure that the muscle tone is good, make sure that they're not super tight, anything like that. So that's the outside exam. And then the inside exam, which if you have a good physical therapist, they'll walk you through all of this. They'll tell you what they're doing, how long they'll be doing it, what they'll be using to do it, and why they're doing it. And the why is the most important thing, obviously, especially in that region of the body. Why is someone touching me there? What are they touching me with? What are they doing? It's hugely important. But we moved to the internal exam, and I can only speak from being a female, clearly. But there's one finger insertion in the vagina, one finger insertion in the rectum. You can say yes, no to any of those things. They don't have to go in. They don't have to see you with your clothes off. Again, that's going to be the best way that they're going to be able to help you. But if you're uncomfortable with that, there are other things that they can do. So a huge part of pelvic floor physical therapy for anyone is muscle massage. That could be internal, external, or both. And then stretching, my physical therapist is a big fan of incorporating yoga into her PT. So that's what we're going to be doing this week, like really focusing in on that. But they also look at like bowel habits, urinary habits, menstrual habits, making sure that there's nothing they can see from a muscle or tendon or anything like that point of view that's maybe interfering with your habits or your cycles or anything like that. So that's where I'm at with my treatment so far. I've had the first appointment, which is the physical exam, and then we're talking about yoga now. We're doing internal, external massage, just to try and see if that's going to help me. Now, with my issues, personally, she thinks that this is really going to help, but it's going to take a while. And the unfortunate part about that is I'm going to be gone, as I mentioned at the beginning of the video. So they recommend pelvic floor physical therapy, actually seeing the physical therapist 1 to 2 times a week for quite a while. And I am only going to be seeing my physical therapist for 4 times before I leave to go back to Buffalo for 10 weeks. So that's going to be rough. And what she's really going to be showing me is how I can do like self-manipulation, muscle massage, stretching, yoga, all of that, to keep up between treatments and then see if I've made an improvement or if we need to make changes or if it's really helping at all. So that's where I'm at with my treatment. That's what I know so far about pelvic floor physical therapy. It's really uncomfortable and slightly painful, but I actually have noticed a difference, especially in the way that she's taught me to think about my body. And this muscle tension, I had chronic UTIs as a child. I was made to feel like my urinary habits were inconvenient, to say the least, to my teachers when I was a kid. So I developed a lot of bad habits when I was young, and I think that's partly where it stems from. It also stems from having Crohn's disease. Now, with Crohn's disease, there's diarrhea, there's watery diarrhea, there's lots of diarrhea. There's being in places where you don't want to have to deal with any of that, so you tighten and you're in a state of tension all the time. And I think that's exacerbated for me, besides the UTIs and the endometriosis and the Crohn's, which is enough. But I I also have this state of tension in all of the muscles in my body. I saw a massage therapist for a long time who just basically said that there was nothing she could do to get all of the tension out of my muscles. And we worked together 1 to 2 times a week for months and months and months back when I had really good insurance. And, you know, we just got to a point where even with heat treatment, ice treatment, elbow manipulation, like, she worked super hard, and she was like, there are some areas of my body where I just carry tension, and there was no amount of work that she could get to lessen that tension. And that's just sort of the way that it is. And until I can get my body to relax from the inside, you know, I was going to have to live with the pain. I was going to have to live with the tension, all of that. So there's a lot of work I have to do on my own, mentally, physically, plus with the help of PT, and hopefully going back to massage at some point to fix what's going on here. And anyway, that's my story. That's my, you know, pelvic PT story. So if you have any questions, please write them down below. And if I get this video up and I get it all going and I get comments before I go back to my PT, I can ask her personally, and I can get those answers for you if I don't know them already myself. So thank you so much for watching. Please, again, write comments, questions down below. Please like, share, subscribe. I know I'm not the greatest video maker out there ever, but I am doing my best, and really making these videos is helping me on a personal level. Even if it's not really reaching or helping anyone else, it really is helping me. So thank you so much, and I will see you all in my next video. Bye-bye.